I'm glad that you're able to join us today at CNN News. Can you briefly introduce yourself?
Yes, hello. I'm the medical engineer at the Gillette Science.
We know that COVID 19 has been a huge issue globally. What do you think is the cause of the pandemic?
It is a consciousness for people when treating disease. The virus is spread by contacting and interacting with people, so the cities that are affected the most are the ones with high population density. However, there is a huge difference between the people in Asia and the rest of the world. Aside from China, the countries in Asia were quickly prepared for the virus and set government policies. In plain explanation, they were prepared. Moreover, they have the tendencies to wear masks day to day, as well as the fact that they will actually stay at home when the health organizations suggest them to.
Why do you think the number of cases increased so fast in the US while Canada's numbers are still increased?
First of all, the people in the United States didn't care about the disease when it first started, and even when it did, they are still hosting parties and beach concerts. As I said earlier, we should pay more attention and be concerned about the virus. Secondly, Canada has limited medical resource and tested very few people. Even when they call and claim that they have the symptom of COVID-19, they just tell them to stay at home without any government restrictions nor data collection. Therefore, the number on the statistic right now for the Canada is fake.
I know how busy it must be for you recently with everything that has gone out of hand, so let's go straight into the topic. What is this new development? And explain the basic cell and molecular biology concepts lying behind the development.
So the remdesivir works by using the polyamorous enzymes from the coronavirus that causes MERS, which is a previous disease that occurred back in 2007. Scientists in God's lab found out that the enzymes can incorporate remdesivir, which resembles the RNA building block, into the new RNA strand. Shortly after adding the remdesivir, the enzyme stops being able to add more RNA to the subunits. This halts the genome replication since the RNA containing the remdesivir has a strange shape that doesn't fit into any enzyme. However, they still need to collect structural data on the enzyme and newly synthesized RNA so the future drug could have a greater activity against the polyamorous.
Wow, so those are some difficult terms. Can you please
Mhm.
describe what it might be like in general terms so our viewers can understand better?
Oh yeah. So describing how the drug will work in general terms will be that the remdesivir will stop the virus replication to prevent its spread around the body by altering a part in the replication.
So, what is the cost of making this drug?
Yeah, so according to the statistics from Evaluate Pharma Vision, R&D cost module, these trials will cost Gillette around $150 million.
So, who came up with the idea?
Yeah, remdesivir is an investigational antiviral drug being developed by Gillette Science that is initially made for treatment of MERS and Ebola. Also, hi, Professor. So from now on, we are changing roles. I'm gonna be the interviewer, and Martin is gonna be the doctor, or like the medical engineer. Why is this new development so important?
There has been many untreatable diseases around the world that reoccurs once every few years. So our original intention was to create an antiviral drug for them. However, the coronavirus hit the world hard, and as of March  31st, there are close to 750,000 cases around the world, and almost 35,000 people have died from this disease. Moreover, the numbers are growing each and every day. This drug is essential for the world right now, and every country around the world is waiting for this drug to be successful. Since even when a patient recovers from the disease, the damage is still permanent for the lung. Even if all 750,000 people recover, there are still chances for relapse.
Yes, I agree with you. And what need does it serve?
It needs both resources and time. Since the drug will be applied to people all over the world, so we need to make sure that there's no room for error.
Hmm. What are the advantages of this remdesivir?
Even though China has claimed that they have zero mainland cases, many countries are still skeptical about this fact. China has pretty bad history when it comes to healthcare and medical research. Just about a year and a half ago, there were hundreds of thousands a faulty vaccine applied to children. Those vaccines were produced by their own people, which says a lot about them when they broke people's moral bottom line. I can assure you, on behalf of the engineer of Gillette Science, this will not occur. Even the National Institute of Health and the Chinese health authorities are cooperating with us in these testings.
Has remdesivir been applicable to SARS and MERS, which is a disease that occurred in the past?
Yes, the first two trials went really well, and there was significant progress, and the results were pretty, which is why we're moving on with our next phase, that is, applying the drug on COVID-19 patients.
So you said that your next phase is to apply this medication to the COVID-19 patients. And if that's possible, how would it be applied?
We have been distributing samples and testing drugs around the world, while we're trying to collect data analysis and try to assure that it is valid for use. Even though many of them have recovered, we're still trying to deliver our drug at its very best, so that it will take some time before we mass produce them.
Are there any disadvantages in terms of technical disadvantages, logistical, or even ethical disadvantages of this remdesivir project?
Yes, we have found an increase in liver enzyme levels that may or may not indicate liver damage. Researchers have also documented similar increases in liver enzymes in 3 US COVID-19 patients. These are only concerning ones at the moment. Even so, the typical antiviral drug side effects also include nausea and vomiting.
Are there any current plans that are being worked on about this side effect?
Yes, of course, but currently we have no official record available to show our progress.
In the United States, the first 12 patients who have been diagnosed with coronavirus, only 3 of them whom were tested with the remdesivir, which was developed to treat the Ebola virus and the SARS virus, but shelved after proving less effective than the other drugs during testing. What can you say about that?
I mean, that is exactly what we're trying to conquer right now.
Since remdesivir is not a direct cure to these viruses, are there casualties?
Yes, the cure currently hasn't been able to fully prevent the virus replication,
Mm-hmm.
so it is not able to fight off the disease effectively at a high rate.
After the remdesivir for the coronavirus is complete, would the company be able to keep up with the demand?
This is one of the main concerns at this point since the demand is skyrocketing, and we didn't expect this when we were developing this drug. But the government and the health organization, as well as people around the world,
Mm-hmm.
are all contributing to help with the progress of this drug. We hope that we'll be able to get it done and don't let people's hope down.
When it's completed, what do you think the cost of the drug will be?
For the price, according to Fierce Pharma, although the price will be affordable, but it'll be on the higher end.
What are some tips for preventing COVID-19?
Prevent going out and have face-to-face interactions.
Mm-hmm.
Stop partying, for example, the St. Patrick's Day festival. Not to mention the Smurf Festival at Paris, where some people even said that Smurf won't get the coronavirus. Wash your hands, stay at home, and protect yourself.
Yes, we're counting on you guys, and we sincerely hope that the coronavirus problem that's going on in all over the world ends soon. And this will be the end of the interview. And I would like to thank all the doctors that participated in this interview, as well as all the researchers working hard every day to produce the remdesivir medication. And let's go into commercials. And when we come back, we will continue our COVID-19 discussion with the UNC Health, Dr. Myron Cohen. Thank you.
I know how busy it is for you recently with everything that has gone. So I know how busy it must be for you recently.
Mm-hmm.
Oh, I'm laughing. Okay.
Okay, go.
Okay. I know how busy it must be for you.
What the?
Okay, let me watch it.
Okay, okay.